Hi, I'm Dr. Rebecca Reese. I'm a physician and infectious disease expert in West Virginia. Throughout the pandemic, I have cared for many patients with COVID-19 and have led research on COVID-19. We are hearing a lot about COVID-19 variants, and naturally there are questions about what they are and if the vaccines are effective at protecting against them. Viruses constantly change through mutation, creating new variants or strains over time. Sometimes new variants emerge and disappear. Other times new variants emerge and stay. Multiple variants of the virus that causes COVID-19 have been found in the United States and around the world during this pandemic. These variants are slightly different from the past strains, and they can even infect people who had COVID-19 before. Scientists continue to study these variants. For example, they are looking to see how easily they spread, the severity of the disease they cause, and how well the vaccines work against them. Ongoing studies have found that the COVID-19 vaccines can help prevent severe disease, hospitalization, and death from the variants. Areas with low vaccination rates are more vulnerable to the virus transforming, potentially becoming more contagious and severe. Large portions of our communities getting vaccinated helps create a firewall against the virus, preventing the virus from spreading and changing. The faster we get vaccinated, the faster we can build a community of immunity against the virus and its variants. Protecting our community from variants is one of the reasons that I chose to get the COVID-19 vaccine and why I recommend it to others. Thanks for tuning in. I'm Dr. Rebecca Reese. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Hi, I am Dr. Marina Galvez. I am a pharmacist and a pharmaceutical scientist in West Virginia. I graduated from my PharmD in 1999 and my PhD in 2004. I have been in diabetes since 2015. Sometimes people ask me how COVID-19 vaccines have been developed so quickly. The COVID-19 vaccine development process has been the most efficient we have seen to date because the entire medical, scientific, and public health communities mobilized like never before to end this pandemic. Although COVID-19 was a new coronavirus, vaccine scientists did not need to start from scratch. These scientists built on a body of knowledge from extensive research of other viruses and the technology used to respond to them. Typically, when vaccines are developed, the development steps occur one after the other, from early vaccine creation to testing its safety and efficacy in clinical trials, to producing it on a larger scale, and eventually to getting it to the public. This process normally takes years to decades for a vaccine to make it from the first steps of development to use it in our healthcare facilities. In response to the COVID-19 pandemic, all these steps were taken simultaneously, removing delays that could normally happen when they are carried out one after the other. Steps to ensure safety were rigorously upheld as the COVID-19 vaccines were developed. The clinical trials, which include tens of thousands of people, showed that COVID-19 vaccination caused no serious side effects and was highly effective in preventing severe disease and death from COVID-19. These vaccines have now been given to millions of people in the US and all around the world, and the vaccines continue to undergo the most intensive safety monitoring in the US history. I trust the top minds from around the world that have come together to develop these vaccines and end the pandemic, which is why I chose to get vaccinated against COVID-19. I encourage others to choose to get the vaccine as well. Thanks for tuning in. I am Dr. Marina Galvez. For more information about COVID-19 vaccines or find a location near you, visit vaccinate.wb.gov.
Doctors, nurses, and pediatricians recommend West Virginians 12 and older get a COVID-19 vaccine because it's the best protection from COVID. Protect yourself and others. Talk to your doctor or trusted healthcare provider about getting vaccinated. COVID-19 is still here, and the new Delta variant is stronger and more contagious than ever, and it's causing cases to rise across the country. If you're unvaccinated, you're at the greatest risk. Vaccination is the best protection from COVID. The vaccines are proven to lower the risk of infection and prevent serious illness and death. It's why doctors and pediatricians recommend that West Virginians 12 and older get one. You can protect yourself from COVID by getting vaccinated.
Hi, I'm Dr. Joanna Bailey. I'm a family physician working in Southern West Virginia. As a family doctor, I get the pleasure of getting to take care of patients of all ages. I frequently care for pregnant women, breastfeeding women, and young children. Some of my patients have asked me whether people who are pregnant or breastfeeding should get the COVID-19 vaccine. The answer is yes. Pregnant and breastfeeding women across the country have chosen to get the COVID-19 vaccine since it was authorized. In that time, vaccine safety monitoring has shown that the COVID-19 vaccines are safe for pregnant patients and their babies. There are many reasons why I recommend the COVID-19 vaccination to my patients who are pregnant or breastfeeding. For one, pregnant women have a higher risk of severe illness or experience preterm birth if they get COVID-19. These bad outcomes can potentially be prevented by getting the COVID-19 vaccine. For another, those who are vaccinated when breastfeeding may have the added benefit of passing immunity onto their babies through their breast milk, which can help protect the newborn from the virus as well. In addition to recommending vaccination to my pregnant and breastfeeding patients, I also strongly recommend that those who are close to them get vaccinated. This helps build a protective cocoon of immunity around the caregivers and their babies. If you have questions about COVID-19 vaccination during pregnancy or when breastfeeding, contact a healthcare provider. Thank you for watching. I'm Dr. Joanna Bailey.
Hello, I'm Dr. Mira Mehta. I am a pharmacist and infectious diseases clinical specialist in West Virginia. During the pandemic, I've served as an expert on COVID-19 treatment and vaccinations in my state and community. Sometimes patients ask me if there are long-term side effects of COVID-19 vaccination. My answer is there are no known long-term side effects of COVID-19 vaccination. There are some things that we know about COVID-19 vaccines and some things that we're still learning about because it takes time. Here are some things that we do know. The COVID-19 vaccines have been evaluated in tens of thousands of people in clinical trials. Millions of people in the United States and around the world have since been vaccinated. COVID-19 vaccines have continued to demonstrate their safety and are highly effective in preventing severe disease and death. Because clinical trials for COVID-19 vaccines started in early 2020, We're still learning whether we can say with certainty that these vaccines will not have long-term side effects. However, we know that vaccines in general rarely cause long-term side effects. In the rare case when there are delayed side effects, they tend to happen in the first 6 weeks following vaccination. The COVID-19 vaccines have been monitored for much longer than that. There is no medical indication that COVID-19 vaccines would cause future side effects. While there are no known long-term side effects of COVID-19 vaccination, we do know that COVID-19 disease can lead to very severe long-term consequences, even from mild cases. This is why I chose to get the COVID-19 vaccine and why I recommend it to my patients. Thanks for tuning in. I'm Dr. Mira Mehta. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
More concerning numbers about the increase of COVID-19 and its variants.
The Delta variant continues to spread around the country and here in West Virginia.
Concern about the Delta variant is growing after a jump in West Virginia's hospitalizations.
The Delta variant is causing so much concern because of how fast it spreads and the danger it holds for the unvaccinated.
If you aren't vaccinated, you're going to get this Delta virus.
Vaccination is the best protection from COVID-19. Protect yourself and others by getting vaccinated.
Hello, everyone. It's Friday, August the 20th. Very regretfully, I am reporting to you that we have significantly exceeded now 3,000 deaths. We have 11 additional deaths since my last briefing on Wednesday. And I couldn't be more positive about this. We're doing a halfway decent job about, getting people vaccinated. We're going to initiate some more incentives today, but it's not good enough. And you can absolutely bet with all certainty that until we get our vaccination rate up and continue to get it higher and higher and higher, you're going to have me sit here in front of you every Monday, Wednesday, and Friday and read a whole bunch more folks that we've lost. It's just as simple as this. The only ticket out of this, the only ticket period out of this whole thing, to being able to restore ourselves to some level of normalcy, is just get ourselves vaccinated. There is no other ticket. There is no other alternative. It's just as simple as just that. So our 2,998th death in West Virginia is a 63-year-old female from Mingo County. Our 2,999th death is a 79-year-old female from Wood County. The 3,000th death in West Virginia is a 60-year-old male from Cabell County. The 3,001st death is a 50-year-old male from Berkeley County. The 3,002nd death is a 73-year-old male from Harrison County. The 3,003rd death is an 89-year-old male from Ohio County. The 3,004th death is a 76-year-old male from Wood County. The 3,005th death is a 74-year-old male from Upshur County. The 3,006th death is a 48-year-old male from Jefferson County. The 3,007th death is a 60-year-old male from Wetzel County. And the 3,008th death is a 53-year-old female from Wood County. It's really a shame, really a shame. And we've been dealt a tough card, and we better really buckle up. We have 925 new cases since our last update. Our positivity rate is at 9.26. We want our positivity rate at 1 point something. Our cumulative rate is at 5.03. We now have 8,806 active cases in West Virginia. 428 people hospitalized and 132 in the ICU units. We now have 18 red counties in West Virginia, only 2 green. This Delta variant, we have 469 cases in West Virginia right now, and all I can do is come and continue to tell you over and over, if you're 65 years of age and older, whether you've been vaccinated or not, and you have any symptoms that are causing you any level of anxiety or whatever, you got to go get a test. That's all there is to it. These antibodies will save your life, but you've got to go get a test. As far as our face coverings, I still urge people, if they're compromised in any way, and they're especially 65 years of age and older, and they're in a crowd of people, they probably should be wearing their mask. I continue to work with all of our local people and try to extend so much local control as I possibly can, but at the same time, we continue to monitor, we continue to watch in every way. I am trying with all in me to keep us together as best I possibly can and still protect us all as well. We have a sector that absolutely believes that they're anti-mask no matter what, and absolutely, we do not have enough data to absolutely right at this point in time make a mandate as far as face coverings. I am trying every way in the world to give as much local control as I possibly can, and at this point in time, we do not have enough information that leans us towards making that determination today as far as moving towards that mask covering today, in a mandate. The Delta variant is dangerous, and it is absolutely with us. We have said it was coming. We had, I don't know what the number was, 15 cases, and it just went for a good while. And then all of a sudden we had 18 cases, and we said, this thing is really not just all over us yet, but it's coming. We better get ready. Well, it's here. It's not eating us alive right yet, but with the number, and I think the number was 469 Delta cases in this state right now. If we don't get ourselves vaccinated and you don't move on getting yourself vaccinated, you can bet your boots that I'll be sitting here reading a lot of you have passed away. So you've got to get yourself vaccinated. And you can bet your boots that if we do not watch, our children absolutely will be the ones that are suffering in lots of different ways. We'll have our children infected, we'll have issues at our schools, we'll have issues with sports, on and on and on. We have had the opportunity. You remember when I held up that USA Today paper, and that USA Today paper basically said just this. It said, this is our fourth surge. It didn't have to happen. It's as simple as that. It didn't have to happen. All across America, if we would have been vaccinated to the levels that we could have been, this surge would have never happened. You better get yourself vaccinated. We're working really hard to be able to give the booster doses to people. We're really close to being able to do that. And I don't want to wait until this September 10th date. I hope to be able to have you some additional news on Monday on that. Absolutely, those that are compromised, and as we've said over and over, they should go immediately right now and get their booster dose and everything. You know, if you're 8 months or 6 months out from taking your first dose and everything, and you're compromised with any kind of illnesses, you know, have attacked or can attack your immunities and everything, absolutely you ought to be going and getting vaccinated with the booster dose. We are still making progress. We have over the last few days, since Wednesday, we have gotten in the arms of folks 4,100 doses. That's pretty good. It's not good enough, but it's pretty good. You know, at least we're getting somewhere. Of those people, how many lives are we going to save? What's that worth? Somebody tell me, what's that worth? And with that, we've gotten now 90.4% of the 65 and olders. We've got 83.8% of our 50 and olders. We are at 70.3% of all those that are eligible to take a shot from 12 and older. This really is a tremendous success story in this great state, because this state has some level of stubbornness. It's led to a lot of the good stuff that we've been able to accomplish through our lives. It's who we are. But for West Virginia to be at 90.4% of all 65 and older, and 83.8% of all the 50 and olders in the state of West Virginia is a whale of an accomplishment. And I salute all those that have worked so hard to make that possible. As far as vaccine eligibility, you know, it's 12 and older. The natural immunities, if you have had COVID, and you may have been told, well, I had it, I don't need to take the vaccine, I've had it. Well, that's probably what could very well happen. You could have had it, because those natural immunities may help you some, but they will not be good enough. So absolutely, if you've just had it and you're thinking, well, I don't have to take the vaccine, you're wrong. That's all there is to it. Young people, 12 to 35, we still are struggling with getting you vaccinated to the levels that we need. We need help from our parents and help from our grandparents there. All the COVID information is up on that, you know, on the info line. You know, I've said over and over, you take advantage of the free testing, get tested, take advantage of this free testing. It's nothing to go get a test to see that you're not, you know, that you're not going to test positive. I thank Frith, I thank Walgreens over and over. We have 21 outbreaks in our long-term care facilities, 9 in the churches in 9 counties. That's Cabell, Doddridge, Fayette, Kanawha, Mason, Putnam, Raleigh, Taylor, and Wayne counties. We have 35 inmates that have COVID right now. We have 28 staff cases. I encourage you over and over and over about giving blood. Like I said, our ticket out of this is one thing. Well, I'm gonna do that last. There's some airport grants that I'm happy to announce today. You know, I'm a real believer that the airports are our heart, the heart of the community. You know, today we're approving a combined total of $444,000 in grant funding for airports across the state. There's 24 airports that will receive grants of $12,500 each that will combine for $300,000. These grants will be used for safety and infrastructure upgrades. In addition to airport funding, $125,000 in funds will be awarded towards airport rescue, aircraft rescue, and firefighting training. You know, there's 2 airports, Huntington Tri-State and Greater Cumberland Regional, that will receive special grants that could open up access to $343,000 in funding from the FFA. And if you could just step back and think about what these airports do, you know, there's an impact study, an economic impact study of West Virginia's aviation industry that identified 10,729 jobs that are related to our airports, and a $1.63 billion of business revenue that's attributed to the airport facilities or airport activities. Today, you know, I want us all to stop just with a very somber semi-celebration and salute to another fallen soldier. Flags will be lowered in honor of Navy Fire Controlman First Class Bernard Raymond Wimmer of Princeton. He was a fallen soldier that is now being brought home and laid to rest. Tomorrow is the day of his memorial services, and absolutely, it's been a long time coming home. This wonderful man that we've lost, our first class controlman, Bernard Wimmer, was on the USS Oklahoma on December the 7th when it was attacked at Pearl Harbor. 429 crewmen lost their lives, and Bernard Wimmer was one of them. He was awarded the Purple Heart, the World War II Victory Medal, and the American Defense Medal. Today, he's being returned home. His remains were in a Honolulu cemetery, but now they have been taken up and accurately identified, and he's coming home. So our flags will fly at half-mast, or half-staff rather, across our state, and please remember this man and remember all of his family and remember absolutely all those that have given everything so we have everything that we have today. I've said it over and over. We owe all that we have to these great people that are now in all areas of the world and all those that we've lost all the way to. All those that we bring home as our veterans, all those that we've lost and have given the ultimate sacrifice, and all their great families. Remember them. We owe everything we have to these people. And thank you, sir. Now, again, in an effort to try to get you vaccinated, and an effort to try to tailor something that would maybe get a few more young people across the finish line, as well as do some additional stuff that, that's been brought to my attention from broadcasters and everything, that maybe we ought to do something else with Baby Dog. So Baby Dog's with me today, and right here, don't you go to sleep now, you're on TV now. Okay, Baby Dog's sitting right with me, and now in the next 6 weeks, beginning with registration on Monday, we're going to go out in the next 6 weeks, we're going to give 5 full scholarships per week, 30 total, to any higher education institution in West Virginia for ages 12 through 25. We're going to give away, in every week, we're going to give away a very high-end luxury sports car. We're going to give away 4 ATVs, side-by-sides, or, a top-of-the-line zero-turn lawnmowers. We're going to give away 1 custom fishing boat per month. We're going to give away a dream wedding, $150,000 per week to someone that is, for their dream wedding. They can spend the money however they choose to spend the money, wherever they decide to spend the money, but for a dream wedding. We're going to give away gas, free gas for 10 years to 2 West Virginians per week. We're going to give away 6 season ticket packages to WVU, Marshall sporting events. And we're going to give away 5 season ski lift, tickets to individuals every week. I want to make sure that we get this right, but we're giving away, the fishing boat is going to be either a bass boat or a pontoon boat, and I guess that just halfway cleans that up. But we're going to start our first official drawing will be done on August the 31st. We will start registration on Monday, August the 23rd, and on every Tuesday thereafter, we'll give away these prizes and everything. For people that are vaccinated, we will give away these prizes for the next 6 weeks. So if we can get a bunch more folks across the finish line, we're giving away lots and lots and lots of scholarships here. So we got to get our young people vaccinated. We're giving away sports cars and ATVs and tickets to our ball games and a beautiful wedding for someone that because we got to appeal to the young girls and everything to be able to do something there. And so a lot of good ideas that have come to me, and this will be do it for baby dog round 2. And so you got to handle this, okay, girl? Anyway, those who are previously registered, I'll remind you over and over, you have got to register again to be eligible. Those who are previously registered, don't just sit back and say, well, I'm already registered. Do it again. You've got to register again to be eligible. So long and the short of it is we'll try to incentivize more and more and more to get across the finish line. I hope everybody is smiling a little bit. We'll have a little bit more fun with this, and Jordan, you come back to this little girl and make sure everybody knows that she loves you, and just like I love you, and try to stay as positive as you can possibly be through this. It's tough stuff. That's all there is to it. We're trying every way we possibly can to get as many across the finish line as we can. Thank you so much.
All right, thank you, Governor. Let's now go first today to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just like to reinforce a couple of points that the governor made and highlight with some data. This is our 5th week in a row of steady increase in vaccinations. And as he pointed out, we had another milestone where over 65% of the 40 to 49-year-olds have had 1 dose. But as the governor pointed out, it's not enough and it's not fast enough. The numbers are moving on us rapidly. As he pointed out, 925 cases today. That's, if you go back, our highest single daily case count in the last surge was 1,715. So we're rapidly approaching that number. We know that today, and Jordan, if you could point up or put up the graph, we are now at 447 hospitalizations. You look at the blue line on the right, that was how long it took us to get to our peak point in the last surge, and look at where we are on the left with the orange. We in less than 2 weeks will be at the numbers that we had at that high point if we don't continue to work hard to get West Virginians vaccinated and blunt this for not just what's left of this surge, which we may not be able to slow down significantly, but what's to come next. So as the governor pointed out, we really need to double down. We need to get folks vaccinated. Those who are immunocompromised, believe they are immunocompromised, need to get out and get that 3rd dose, because we know it is significantly important to helping those folks going forward. A couple other points of data just to reinforce the governor's points as to why we've got to get vaccinated. Our average case age is now dropping to 41 years of age. Our average death dropping to 74 years of age. And our hospitalization average age is dropping significantly, now below 60 years of age. So West Virginia, we wouldn't be asking you to do this if it wasn't important. Please go out and get vaccinated. It is the best line of defense that we have to address this surge here and to prevent future death and hospitalization, reduce the number of deaths, and protect the integrity of our hospitals. Thank you.
Thank you, sir. Secretary Bill Crouch with the DHHR and Dr. Ayn Amjad, our State Health Officer, are also joining us today and are available for questions. Dr. Clay Marsh, our coronavirus czar, had a prior engagement today. He will rejoin us on Monday. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Greetings to everybody. I'm in a hospital waiting room having some tests done, nothing to worry about. First of all, I'm glad to see Baby Dog back, and we have another incentive program targeting our youth. I know I suggested that a few briefings ago. I'm glad to see it and hope it's a big success. My question is this, Governor and staff members. Is there a way to tier the masking the mandate? Let's say we have a mask mandate for all counties that are in the orange and in the red, and maybe the gold too, and then you would have no mask mandate in counties that are yellow and green. That way it creates an incentive for those counties that are red and orange to get more people tested, more vaccinated, and bring their numbers down and reduce their color and eliminate the mask mandate that way. Is it possible to do that?
Let me take this, Mark. Another idea that we've discussed and we're discussing all the time, all kinds of different alternatives and everything, without any question, it's a good thought, and it's surely something that's on the table, and we're just hanging on, as long as we possibly can to try to keep everybody together. But this is something that over the weekend there'll be a whole lot more discussion. We'll see where we stand and everything, but it's a good thought.
All right, thank you, Mark. Next to Aaron Williams with WBOY.
Good morning. Sorry, I got to hit the unmute button there. Governor and panel, my question is related to masks in schools. You've talked again today about leaving those decisions to parents and local officials. I'd love to hear from you, Governor, and as many of the panel members as possible. If you were sending a young child back to school this year, a child that's too young to be vaccinated, would you put them in a mask, sending them back to school? And if you could explain why or why not, that'd be appreciated. Thank you.
Well, to be, and again, I'm not going to dodge any question whatsoever. I've got a lot of knowledge, and I've been given a lot of knowledge from the medical team and the medical experts. You've got to evaluate just this, and this is all there is to it. From your child's standpoint, is this going to have is a child really going to feel, is it going to cause them issues that could impact them psychologically and all kinds of things like that? Versus, is there real information that would say to us that they're going to be safer? Right now, that information in my book, and again, you know me well enough to know that I don't dodge anything. Right now, that information is not clear enough for me to move towards this moment saying, I would put my child in a mask and send that kid to school. So with that though, every day that goes by, we get closer and closer and closer to a situation to where the safety outweighs a negative impact because we have more data. But I don't know how to answer it. I just don't know how to answer it except to just say just this. If I decided that in my mind that I felt like that my child would be better off to have a mask on in school, I'll put a mandate on the entire state. That's all there is to it, because I don't want to ever think that I'm going to slight another child because it's not my child. There's no way. There's just no way. So right now, it is too much of a toss-up. Too much of a toss-up to know that absolutely clear-cut enough that we should be doing it.
All right, thank you, Aaron. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I want to go back to something Dr. Marsh said about the spread of the Delta variant being more like spreading chicken pox. And I've seen numbers to where the spread of the variant has increase from maybe one person giving it to 2 to one giving it to as many as 9 people. Do we know if this would possibly spread through a ventilation system more easily than the original version of COVID-19? And that can go to anybody who wants to take it. Thank you.
Dr. Amjad, if you could answer it, please.
Yes, Governor. Paul, there's no data or studies out there that I'm aware to any ventilation system. We still think it's, or have information that is spread by respiratory droplets. The information that it's as contagious as the chicken pox that you said, and as is because of the information that is out there that, you know, as you stated, not just another or 2 people as to 8 people, is that it's highly contagious from the information that we have, but there's no indication that it's spreading through a ventilation system or anything. So it's just the respiratory droplets that we know of as the other variants that we have. So we want people to stay home when they're sick, to wash their hands, and to keep the distance if they're sick or if they know that they're infectious at this time. Thanks.
All right, thank you, Paul. Next to Charles Young with WV News.
Hi, y'all. This is Charles Young with WV News. My question is about our latest incentive program. Governor, do you have an idea of how much overall we plan to spend on round number 2 and where those funds will come from? I know you previously said that we used, leftover care funds for round number 1. Are we going to be doing the same for this next round? Thank you.
Charles, we are, and I would estimate that this is about $6 million. I don't have that number exactly in front of me, but $6 to $8 million. But we've got the money, and we're talking to all kinds of different businesses, that are going to supply the stuff, and so we've got the money. It's not going to take from anybody or any bucket and everything, but we've got the money to do it. It's just a matter of, gosh, you and I both know it's kind of a shame to think that we've got to do something to incentivize people to get vaccinated, to be able to save their lives or their families or their friends or whomever it may be. It's kind of a shame, to think we've got to go to that, but we do anything and everything we can to get people across the finish line. So yeah, we've got the dollars. We'll just keep at it.
All right, thanks, Charles. Next to Tori Yorgi with WSAZ.
Hi, everyone. This is Tori Yorgi with WSAZ. Thanks for taking my question. I actually wanted to ask, I know General Hoyer just spoke about the age numbers, the average age numbers decreasing from what we were used to in the last surge. I wanted to ask, I know you all spoke about listing vaccinated versus unvaccinated for the people who are hospitalized currently. Can we expect to see that anytime here soon listed on the website? And can we also expect to maybe see age brackets as far as hospitalizations go, just so we have an idea of who's being hospitalized, because we're hearing a lot of children potentially might be being hospitalized this time around, but we obviously need to confirm that through the website. Thank you.
I think General Hoyer, can you do this, sir?
Yes, sir, Governor. I'll rely on Secretary Crouch to help. Tori, we continue to work with the Hospital Association to pull data together related to vaccinated versus unvaccinated. So we'll have more on that. And I know Bill's team at DHHR and others have been working on being able to put more data on. But what we need to work is to make sure that we provide you with appropriate and accurate data as opposed to just pushing things onto the site. But I'll turn it to Bill for other comments.
Thank you, Jim. Hi, Tori. The data you're referring to in terms of hospitalization is actually not at DHHR, but it is Hospital Association data. We're working closely with them. We get a report every day. We're beginning to get better information in terms of age breakdowns of individuals in the hospital and breakthroughs. As you know, we place the breakthrough information on the dashboard in terms of cases and in terms of deaths. It's very difficult to get that count daily from hospitals in terms of how many individuals with COVID are in their hospital and how many are already vaccinated or not yet vaccinated. So, but we are working on that. And again, we try to keep the dashboard moving and add to information that we can that makes it more beneficial for folks out there. So good question. Thank you.
All right. Thank you, Tori. Next to David Beard with the Dominion Post.
Hi. I wanted to clarify the distinctions between the two different booster efforts that are going on. The first one is for the immunocompromised. And does that apply to any age or only 60 and up? And how do you get it? Do you just show up at a vaccine site? Do you need a doctor's note? And is there a time limit? Do you have to be 8 months or 6 months out from your first vaccine if you're immunocompromised to get that? And the other one is the one that'll start, well, it's tentatively set to start September 20th for, I guess, anybody who's been vaccinated. But again, is there an age limit on that? Is it 60 and up? And again, how do you go about getting that booster once that starts up? Do you have to have a doctor's note saying you're 8 months out, or just show up at a vaccine site with your card to prove you were vaccinated 8 months ago? I think that kind of covers it. I'd appreciate some clarification on those. Thanks.
Dr. Amjad or General Hoyer, you know, you guys, could you fill in that? I can do it, but you can do it better than I.
Yes, Governor, I can start, and I apologize if my thing is breaking up a little bit. But so the first part of your question for the third dose, it's for any age who's immunocompromised, and you don't need a doctor's note. But when you go, you're basically going your word of honor, but you have to do a test for it. So you have to sign something at the pharmacy or say the health department, and you're basically someone who's of any age, but you're on, say, chemotherapy drugs or immunosuppressive drugs, or someone who's taking maybe prednisone daily for something. So you have to go on certain medications to qualify, and saying that you are immunocompromised, but you don't need a doctor's note. So that's for the third dose that's currently going on now. But that's for anyone who's 28 days after their second vaccine. Take your vaccine card to the pharmacy or the health department so they can see when you took their last dose. So that's for the current one that's out there now. The third dose that they're calling it, or that's what they're calling it right now. To answer your second question, for this booster dose that's coming out on September 20th, that's a little bit different. So that's for anybody who's going to need this booster dose or the other shot, third shot. I mean, these words are being interchanged, unfortunately. The one that's given out right now for immunocompromised or the third dose, you would just show up with your vaccine card and you're self-attesting for that, David. But I don't know if General Hoyer has anything else to add to that.
No, I think you covered it well, Don.
All right, thanks, David. Next to June Leffler with West Virginia Public Broadcasting.
Good afternoon, panel. My question is for the governor. I am wondering what went into the decision to spend more money on this vaccine incentive program. You know, looking at the numbers, the vaccination rates during the last vaccine program, numbers went down and didn't go back up until, you know, let's say early July, when people were, you know, also becoming more kind of worried about the Delta variant. So just tell me what went into that decision, and if there's going to be any sort of kind of evidence-based protocol to assessing the effectiveness of these vaccine incentive efforts.
Well, June, I take real issue with you, you know, from the information that I've been given, and I think I'm giving awfully good information, but from the date that we started the last campaign through when we ended the campaign, there was 180,000 people that got vaccinated. You know, now, June, you know, I surely hope that people are hearing us, with this Delta variant and moving towards getting themselves vaccinated. But we've still got a bunch of folks out there, do we not, June? And with those folks, we have hospitalizations, we have deaths, we have everything under the sun that's causing all kinds of issues all across this state. And more than anything, we continue to lose great West Virginians. And so really and truly, the federal government provides these funds. And one of the things we can do with funds is just exactly what we're doing. And I hate to say this, but this is a drop in the bucket. This is a drop in the bucket compared to what we can save and what we can do if we're more and more and more successful. So, it also helps our businesses in every way all across our state from the standpoint of, there's surely the businesses, pick up a little bit of revenue from the prizes and stuff that we give away. But more than anything, in my opinion, what the businesses get is just this, is, we hope and pray we're not going to get to a point in time. If we don't do something, June, we're going to end up, just think how it felt. Please, somebody tell me how it felt when we were all in masks, school was all virtual, businesses were shut down all over the place. Do we really want to threaten ourselves to go back to something like that? Really and truly? Are you kidding me how much revenue that we lost in this state and all the different things that happened? Other states are doing exactly what we're doing, and to throw out, the idea that this wasn't effective and didn't work, come on, June, come on. You got to be kidding me.
All right, thank you, June. Governor, I'll turn it back to you.
Well, the only thing I would add is just this, is I hope to goodness that no one is sitting out there rooting for the incentive program on Baby Dog to fail. Because if the incentive program on Baby Dog is not successful, then that means we're not getting people vaccinated. And basically, you're just sitting there then rooting for more people to die. Well, I'm going to tell you, any and everything on this planet, no matter if it's having these briefings, if it's doing the Baby Dog stuff, if it is absolutely doing all the education that all the people are doing out there, the word of mouth, I don't care what it is. Whatever we can do to get more people vaccinated, we need to be doing it, and we need to celebrate that. Celebrate that. We do not need in any way to root for death. How in the world can we sit and applaud death? And so we got to continue to do all we can do, and we're going to do just that. And we're going to beat this thing too. We absolutely have done great in West Virginia in so many different ways. We're absolutely going to beat this thing. And then West Virginia is going to be just what it is over and over and over in the recent years. It's becoming more and more and more that shining star, that absolute treasure that everybody missed, the diamond in the rough that they missed absolutely over and over. We've always known how good we are. We've always known what an incredible place West Virginia is. We just needed the world to know it. And now we see the world knowing it over and over and over. We're going to beat this thing. Absolutely, just stay together. That's what we got to do. Some way, somehow, we got to all pull the rope together, and we're going to beat this thing. Thank you a bunch.
Hi, I'm Dr. David Hess, and I'm a primary care physician in West Virginia, and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me,